Being an alum of BNLP, UHI reached out about funding opportunity to do work that was more strategically placed in being community facing, addressing social determinant of health. CLIA being an intergenerational organization, positioning young people at the tables of Baltimore City Health Department. And what we did was be very intentional in doing two-way training model of equipping our adult personnel, staff, and professionals on how to positively engage with young people, but also to prepare young people to work with adult professionals as well. And this funding allowed us to do that because it allowed us to compensate young people as credible stakeholders, right? So now the young person sat at these tables along with adult staff and employees that this is their 9 to 5. Oftentimes, young people are asked to be at tables, but their level of autonomy at tables is not equitable. UHI was supporting CLIA and us building our intergenerational approach and pillars as our organization that helped us fortify that for CLIA. The second to third largest agency in Baltimore is the health department. The number one institution in research in public health in the country is Hopkins. So who else do you need to help fortify and validate the work that your organization already is trying to naturally build? This funding allowed CLIA to position ourselves as assets, a part of this collaborative partnership, versus an entity that is coming with a mindset of just happy to be at the table. But it was more of like, we're deserving to be at the table. And I think that's where UHI definitely helped in knowing, like Tamar, it was an easy go. And being already having prior relationships and relationship buildings over the years with UHI, it made it easier to work because you have this interpersonal relationship of everybody's already credible by observance and already working hand by hand with each other. So it wasn't strangers coming to a table, it was leaders of familiarity coming to the table and saying, this is what this entity can bring. Just myself being very astute of what offerings that UHI has, the staff themselves reached out to say, hey, I think this might be an opportunity that you all need, positioned and ready for, right? And then let me walk you through it. And that was beautiful because it didn't come with a savior complex. It came with a let's do this together complex. These urban populous cities are all trying to do the same thing, right? And Baltimore, most of the time, is a catalyst. When we do bad, the nation feels it. When we get things right, the nation replicates it, right? And I think this allows Baltimore, because of the support of UHI, to see ourselves as assets as well, and to see ourselves as catalysts for something that's good versus having to debunk the national perception of us being a gritty city that always gotta be resolute. I'm showing our young people like, no, politics is just as important. It just isn't as shiny and entertaining, but it doesn't mean it's not as powerful. So we have to reprogram the mind of our young people to say, like, this is important even if it doesn't go viral. This is important even if it's not sensationalized. You start to show them and teach them that, like, and then you have to teach them language so that the adult leaders and the partners in the space are not talking around you, but talking to you, and you able to talk back.